Hello, my name is Gilda Grobe, and in this presentation, I will be going over gait development over the lifespan. I will talk about the stages in gait development, principles related to each stage of development, possible constraint, and a common abnormality in each stage of development. Before we begin, we need to define what is gait and what is walking. According to Lee and Grimson, gait is defined as a manner of walking. However, human gait is more than that. It is an idiosyncratic feature of a person that is determined by, among other things, an individual's weight, limb length, footwear, and posture combined with characteristic motion. And according to Haywood and Getchell, walking is defined by 50% facing relationship between the legs as well as a period of double support, when both feet are on the ground, followed by a period of single support. The four main stages we will be going over are early childhood, adulthood, and older adulthood. Let's start with prenatal development, as it is the foundation of what will eventually give rise to a human. So, even before being born, factors that can possibly lead to abnormal prenatal development would be genetics or the environment. Starting with conception, an embryo is formed, which will later become a fetus. While it begins to grow, it can be sensitive to any extrinsic factor and nutrients that the mother may consume. Based on our learning, according to Haywood and Getchell, there are critical time periods where if the mother is exposed to teratogens, it can affect the growing fetus. For example, if in week 20, which is the time where myelination of the spinal cord is occurring, the mother is exposed to a harmful substance, it can affect walking or moving the arms in a negative way, since the spine is an important part of the skeletal system. Now we move on to early childhood. We see that infants grow relatively fast, from the cephalocaudal, or head to tail, and proximal distal, from the trunk to the outskirts of the body. In this case, it would be the hands or the feet. We also start seeing that the infants' movements are first spontaneous movements, then randomly kick their arms and legs, which according to Haywood and Getchell, these reflexes are called infantile reflex. During this time, we can also see that the infant begins to journey towards voluntary movements. The child also begins to be more alert because of external stimuli. During early childhood, we will also be able to see that the child will be able to lift its head up, crawl, and sit on his or her own, and eventually the child will be able to stand. When standing, the child will be trying to have enough balance in order to completely stand up without the need of any help. It also has a wide base of support, the toes are pointed outward, and the arms are at high guard. And as the child takes a step, each step is independent of the next, and the initial contact is with a flat foot. Some of the constraints, legs must be first strong enough to support him or herself on a single limb. There needs to be balance, which is something that the child is still trying to develop, and there also needs to be leg strength. A common abnormality that would be seen in early childhood would be delays in motor milestones for children with cerebral palsy. And according to Sutherland and Davis, gait abnormalities in children with cerebral palsy are the consequences of contractures across joints, muscle spasticity, and physically inappropriate muscle action. Next, we have childhood. As a child grows into being a toddler, we can start seeing how the child's stride length begins to increase. There is more and greater leg extension at push-off. Also, there's a base of support. The base of support is reduced a little. The arms eventually start being a little bit more at the side, and there's a little bit of trunk rotation. And as the child is more comfortable, it begins to challenge himself or herself by exploring things. The child eventually also begins getting more proficient. And according to Haywood and Getchell, at around age 4, most children have the essential elements of being an advanced walker. Some of the constraints would be environmental changes in the sense that this toddler now begins to explore. It starts body scaling, meaning that he or she has tried to see if it can overcome environmental constraints, such as climbing stairs. Children begin growing into their feet, which is commonly seen when children tend to trip over themselves. Other possible constraints would be visual disturbances, such as needing glasses, or ear infections, which can cause balance disturbances as well. A common abnormality in childhood would be acute ataxia. What is ataxia? According to the Journal of Child Neurology, it's referred to a pathologic abnormality or modulation of movement. This is usually seen with children who don't want to walk and develop a wide-based drunken gait. Another common abnormality would be any type of limping, which may consist or may be due to a fall, limb length discrepancy, or Osgood-Schlatter's disease, which many doctors contribute as knee pain, but in reality it is an irritation of the traction of the epiphysis with the patellar tendon attaches to the shin below the knee. Some of these treatments for Osgood-Schlatter's disease would be decreasing the activities that may cause irritation in the knee, so no running or sports. A task constrained with people who have certain disabilities or even people who are learning new skills will often attempt to improve balance by increasing their stability. Here's a picture of a gait cycle. One of the differences we will see from a child who is barely learning how to walk to a more proficient walker would be that the proficient walker will start with a heel strike versus when one is barely learning how to walk, they will start with a flat foot. And as you can see here, this would be a proficient walker as we are starting with heel contact. If I were to start with a younger child, the next one where the mid stance is, you'll see it a flat foot. So a new learner would start with a flat foot. Now we move on to adulthood. And as we can see, as one continues to grow, not only is one a proficient walker, but running, hopping are things that one can also do. While walking, the gait changes that can be seen would be better base of support, such as shoulder width apart, a better center of gravity, and the heel-to-toe contact absorption, and a longer stride. In adulthood, there are a few individual constraints, especially if one either loses or gains weight, or environmental, such as it being too hot or too cold. A rate limiter would be if any of the systems in the body lags. So if an adult breaks an ankle and the bone doesn't heal fast enough, musculoskeletal system could be affected by loss of muscle mass, or if one gains more fat, there could be hormone imbalances that can cause imbalances in the nervous, endocrine, and immune system. Environmental factors would be smoking or pollution, also not eating healthy food that can replenish the body with vitamins or minerals. Abnormalities would be injuries such as a fracture or a sprain or any type of surgery that may involve the lower extremities, such as an ACL tear or what is called an anterior cruciate ligament. That affects the knee. And sometimes a person will be immobilized by wearing a brace or a knee immobilizer and using crutches in order to walk. Moving on to older adulthood, we are able to see even more differences. From having longer and faster strides of the lower extremities, we are now not moving as fast, and the feet are closer together, and in some cases we're reverted back to being flat-footed. We're flat stepping. For men, there is a reduced degree of ankle extension. For women, there is a greater out-toeing and a shorter stride and less pelvic rotation. Next, we have some constraints, which aside from aging, there is a typical wear and tear of the body. There can be visual disturbances that can enable one to adequately see and thus limit one from walking as much. There can also be medical problems that can attribute to this. It can potentially become a decline in muscle mass. Other constraints would be that they don't want to walk because they have had a history of falling and breaking a hip or a knee. Some of the common abnormalities would be if a person had a stroke and it affected them to the point that one side of their body is weaker than the other. Also, a person can have some sensory deficits. And according to Salzman, common causes of gait and balance disorders in older adults would be arthritis, orthostatic hypotension, which is when you're sitting down and all of a sudden you get up and you get really dizzy. There can be hearing impairments or use of certain medications, and especially if an adult has osteoporosis, it can increase the risk of fractures, which can lead to falls. Um, so, of course, it is important that we are aware that as we age, so will our body. So we will see how the development in our gait will have to adapt to the new changes that we'll encounter as we get older. Thank you.